Over the years, thousands of health complications have been reported following the implantation of synthetic mesh, including the bladder sling. In 2012, the FDA reclassified this synthetic mesh from moderate to a high-risk medical device for the treatment of pelvic organ prolapse. More recently, mini slings were introduced. Dr. Hibner explains what complications he's seen with these smaller devices.
I don't know how many of those were placed, and I have no way of telling whether the rate is different than the patients that had transoperator slings, but there's definitely patients that still show up with that type of sling. It is true that those mini slings do not pierce through all the muscles that the older types of transoperator slings were, but they still attach somehow to the operator membrane in order to stay in place. The pain from mini slings may be as debilitating as with transoperator devices.
Unfortunately, most of these mesh devices were designed to be embedded in the muscle tissue that are adjacent to vital nerves, which are responsible for mobility, sexual function, and bowel and bladder function. Health complications following mesh implantation include muscle spasms, nerve damage caused by either compression or traction, leading to chronic and often severe pain. Also dyspareunia, which is pain with intercourse, bleeding, mesh erosion, and worsening of incontinence, sometimes involving interstitial cystitis, which is a painful bladder. Dr. Hibner discusses how interstitial cystitis or painful bladder occurs after a mesh implantation.
It is an allodynia of the bladder. So an allodynia, what it means is that the slightest sensation to the bladder causes pain. So normally the bladder should only hurt when it's really full. It most likely originates, in my mind and other people's minds, from some other painful condition somewhere else in the pelvis where the muscle spasm happens. And with the muscle spasm, the patients develop obstructive voiding. And what it means is that the muscles don't relax enough for patients to empty the bladder. It really becomes, again, another positive feedback loop where now the bladder becomes overtly sensitive because it's trying to squeeze the urine out. Now the problem is when you have a patient that, let's say you have placed the mesh and you've caused that muscle spasm, then it may lead to that symptoms of that painful bladder syndrome.
Often treatment of interstitial cystitis involves hydrodistention, which is filling the bladder with a saline solution.
The hydrodistention actually helps them with a symptom as long as you treat it in other ways. So it is like you have pain from muscle spasm and you take a muscle relaxant. It's not really curing your muscle spasm, but it is helping you temporarily with it. So that's kind of what hydrodistention is. I mean, I think it is still an important procedure. It's not going to cure that patient's pain unless the mesh comes out.
Failure of a mesh device can lead to erosion of the bowel and bladder, severely disrupting their function.
It is a significant problem because, well, number one, it may cause the leakage of the content of the bowel or the bladder into the abdominal cavity. It may cause peritonitis, but it also by itself is very painful. It requires a very complicated surgery to repair it and to close the defect. So yes, it is a significant surgical problem.
Symptoms of adverse events caused by synthetic mesh sling implantation can occur immediately after surgery or years later. When implanted, the devices cause scar tissue and over time are known to shrink up to 20 to 30%, leading to traction on adjacent structures, including muscles and nerves. Particularly impacted by mesh device shrinkage are the clitoral nerve, the rectal nerve, the pudendal nerve, and the obturator nerve.
So not all women develop pain immediately after mesh, and that is very perfectly explainable. Mesh shrinks over time. So if you actually do the surgery for the mesh removal, you can actually see how it's fixed to the muscle. There are points in the muscle where the mesh is fixed. So if you take a piece of mesh and it's fixed to the muscle, and then over time it shrinks by 30%, and those studies are done, we know that the mesh shrinks. You will see that with time it is like maybe it doesn't pull on the muscle immediately after the placement, it may pull on it a few years later.